students. I want to talk to you a little bit about your week 2 discussion. Now, this week we're going to talk about and explore the ICD-10 PCS coding system. And this system is for the patients that are in the hospital for procedures and such. So this is different from the ICD-10-CM that we talked about last week. In ICD-10-CM, these are your diagnosis codes, or why the patient's being seen. And those are used throughout healthcare. They're used in the inpatient setting and the outpatient setting as well. So the ICD-10 PCS system is only going to be used for patients that are admitted to the hospital for the treatments and the procedures that they're having. So in our discussion this week, that's what we're going to be talking about. This coding system supplies the codes for treatments and the procedures provided to patients that are admitted to the hospital. And these codes differ from those used to treat patients in the outpatient setting, such as a doctor's office or a clinic, or even in a hospital that's doing outpatient services. So one of the major challenges with the implementation of this ICD-10 PCS system is that it's described as a language that requires coders to possess a higher level of reasoning skills, and it's got a lot more granularity. So make sure that you review that attached document called Development of the ICD-10 Procedure Coding System. And it's going to give you more information and give you some substance to talk about and answer the questions in this week's discussion. After you've looked at that, I want you to respond to the following prompts in your initial post. You want to explain the purpose and the function of ICD-10 PCS coding system. And if you download and read the development of the ICD-10 procedure coding system, you're going to have a good understanding of that. You want to make sure that you also include the reasonings for why we transitioned from ICD-9 Volume 3. This was the system we used before ICD-10. And then number 2, you want to answer which of the 4 major goals used for the development of ICD-10 PCS do you think are the most valuable for inpatient coders? And you're going to see those when you download and read the development of ICD-10 procedure coding systems. And you want to make sure you explain your answer. So answer which goal that you believe is the most valuable and why you believe that. And number 3, do you think inpatient coders will need to have a more in-depth understanding of anatomy and medical terminology to use ICD-10 PCS coding system? That will be yes or no, and then why or why not. So that's how you're going to get started. Make sure that you get that in by Wednesday at 11:59 p.m. Eastern Standard Time. If you need more information about the PCS coding system, you're going to find that in Chapter 27 in your step-by-step coding, your step-by-step textbook. If you have any questions, just reach out to me. Thank you.